so we may have a couple coming in. And if so, I will direct them where to go. But for all of us that are already here, this is a presentation that we've been looking forward to since before COVID, right? Where we scheduled like spring 2020, part of that that we had to shelve. And so we've been looking forward to it for a long time.
Now that we're all 21 or older, handle this stuff.
That's right.
Yeah. But we are really honestly looking forward to this. And Spencer McCombs, I wanted to make sure I said it right, owner of McCombs and Associates Physical Therapy, is a doctor. I heard you guys talking about that, a physical therapy and specialist in vertigo, back pain, sciatica. And is your office in Levelland, or do you have one in Lubbock and Levelland, or just Levelland?
We'll have one in each location.
Okay.
So my office here is on 82nd and Slide.
Okay.
That's McCombs and Associates. And then in Levelland, we have another clinic we call Levelland Physical Therapy.
Okay. All right. Well, we are so excited to hear your presentation and maybe even workshop, which that.
Yeah, I call it a workshop just so it's a little more interactive.
Okay.
But
all right. Well, with that, I'll just turn it over to you. Thank you.
Sounds good. Well, I'm really glad to be here tonight. I'm glad that you guys came and hopefully can learn something. Like we said, I've been a doctor of physical therapy for about 18 years, and I practice at both locations, and I have therapists at each location. So we're open Monday through Friday. We have a number of therapists that specialize in vertigo and dizziness. We're a very hands-on clinic, so we do a lot of stuff with back pain and neck pain, shoulder pain, knee pain, vertigo, dizziness, and balance. Those are our main areas of emphasis. And so I've been doing these workshops at my clinic that I open up to the general public for about 5 years. But I haven't done one in a little while. So if I'm a little rusty, be patient with me. I try to explain it in a way that's very understandable. So I want you to interrupt me at any time. If you have any questions, don't hesitate to ask. And I'll be asking you questions. And so now typically I present this to an audience of people that have dizziness or vertigo. So let me start by asking a question. Let's say in the last 30 days, how many of you have had dizziness or vertigo? Okay, not bad for just a general audience here. Now, maybe you knew I was coming, so you signed up for this class specifically. But if you answer my questions correctly, I may do a demonstration tonight and show you a little bit about what we do. Now, the good thing about dizziness and vertigo is it's one of the easiest things that we cure in physical therapy. Now, I doubt many of you would think just off the cuff that a physical therapist would treat dizziness or vertigo. You may think medication's required or an ear, nose, and throat doctor's required. But because the treatment is movement-based, physical therapy has specialized in this area. Now, not all physical therapists specialize in this. I've taken additional training, as have some of my other physical therapists to specialize in this. But let me start with those of you who raised your hand, or some of you who may have a friend or family member with vertigo or dizziness. What kind of symptoms do you experience? Because it's all a little different for each person. So the dizziness or vertigo that you experience, what are you experiencing?
Swirls.
Okay, so when does it tend to hit you? When you're doing what?
Whenever I raise up.
Out of bed? You go to sit up. Okay. And how long has that been going on for you?
Well, I sustained head injuries a long time ago, and so the crystals in my ears got dislodged.
Oh.
And so it's just episodic ever since then, ever since 2001.
So it's not every time you sit up for the last 20 years, it's just occasionally. And then does it come and does it last for like a week or two at a time?
Yeah.
And then it will be better for a few months and then it might come again?
Yeah.
Is that correct? Okay. What's your name?
Cherie.
Cherie. So what have you done to treat that over the years? Anything, or you just kind of live with it?
Well, an audiologist will work with me to restabilize the crystals.
So they do specific head movements. Okay, good. Have any of you heard of what she's describing, which is called Epley's maneuver? Have any of you heard of Dick's Hallpike maneuver? You've heard of it?
It's called what?
Dick's Hallpike. or Epley's maneuver. There's one that's a test, which is very similar to the treatment, but that's good. So that typically helps when you have that done. Okay. So Cherie is describing, when she talks about crystals, she's describing something called otoconia, which we're going to talk about, and how those little crystals get into your inner ear and how they can cause vertigo. So by the end of this workshop, I want y'all to understand perfectly how crystals can cause vertigo in your inner ear. So thank you, Cherie. Who else? I saw a couple other hands. Yes.
Walk down the hallway and walls move.
And do the walls end up bumping you on the shoulders, or
I've been doing it long enough that I put the hand up there. Handrails are good.
So is yours episodic as well?
Sure. Yeah, it's sort of always there. Because I was in your office a couple weeks ago, and all of a sudden the office just moved.
How long has that been going on?
About 15 years, maybe.
Yeah.
Okay.
I had it. They think it was a virus, and lost a number of nerves in this
Okay.
ear. And so we treated that, but we also had the crystals, and it got halfway better.
But then now you just kind of live with it.
Sure.
And it's only when you're walking down the hall?
Well, if I get up the wrong way, that one's much less frequent.
Okay, one more question. So what's the right way to get up and the wrong way to get up for you?
Actually, that's how I have my head turned.
Okay. So if it's turned down and to the left and you get up, are you good?
No.
That's the bad way.
Yeah, that's what the ceiling moves.
Okay. So, this vestibular system that we're talking about, there's one in each ear, and usually just one of them's affected.
So can you have them in both ears? Because I'll just have in one ear.
You can.
It would be very traumatic.
I'll test people and they'll be positive on both, but it's whichever side is the worst. That's the side I'll treat. And it's usually, like I said, very successful. High cure rate. So Cherie, 21 years you've been dealing with this. 15, what's your name?
Bill.
Bill, I knew 15 years. So now if you were my patient, I'd say that's unacceptable. Because if you're still dealing with it, there's something that we're missing. Because this isn't the sort of thing where you have to go back again and again and treat, if it's treated correctly. So for your sakes, and anybody else here that may be dealing with, I hope to give you some tools today to help you to see how this could be treated permanently, or at least point you in the right direction to where you can get permanent lasting relief. But that's my expectation. And 90% of the time, that's what we get with our patients, is a 100% cure. And the other 10%, sometimes it might be like they had a pacemaker put in, or they've changed their blood pressure medication, and they're getting a side effect of their medication. And we just can't quite get them all the way. Maybe they need some adjustments to those things. So, all right, any other hands? Bill and Cherie, any other hands? Yes? What have you been
Mine
experiencing?
is basically a loss of balance.
Okay, so can you describe that more? Like what do you
When I turn
experience?
around too quickly,
Okay,
or I move in a direction that I don't think that's where I want to go.
and your mind says wrong way, so it makes you dizzy, so you'll turn. So do you feel dizziness in your head, or does it feel like in your feet, like you're?
In my feet.
Okay. Do you have any medical conditions that you're aware of that might be causing that?
I like alcohol.
Does this happen when you're not drinking?
No, this happens when I'm not drinking.
Okay, okay,
It happens right after a cup of coffee sometimes.
okay. So it may not have anything to do with it.
No, it does not.
Does it have anything to do with going from sitting to a standing position? Okay, so it's just directional changes. All right. So you may be dealing with the balance side of things,
Right.
which is you have nerves that go to your brain, and very quickly your brain sends signals back down to control your feet. So with practice, you can get better at that. And at the end of the workshop, if y'all answer my questions and laugh at my jokes, I'm going to give you a little device on like balance and falls,
Okay.
which can be separate from vertigo and dizziness.
Okay.
All right. So that's a good. What's your name?
Charles. Chuck.
Charles.
I go by Chuck.
Chuck. Okay. Well, good. Anybody else dying to share? Otherwise, I'm going to go on. Okay. Well, I want to do a quick demonstration, or not demonstration, a quick test on everybody here. Okay. I promise it's not a hard test. If you were able to walk in here, you can do the test. Okay. So if I can just have everyone stand. All right. You need to move it?
No.
Okay. Okay, so let's just have you bend your head forward like this, and you can lean forward a little bit
Are you gonna start something?
and then come back up. What'd you say?
Are you fixing to start something?
No. Well, we're just checking to see if, okay, and go back up to normal. Did anybody get dizzy when they put their head down like that?
No.
Okay. All right, now. No? Okay. Let's go ahead and look up at the ceiling. Don't fall backwards. Just look up at the ceiling and then back straight ahead. Anybody with that motion get dizzy? Okay. Now go ahead and turn your head to the right, just like that. Good. Back straight ahead. And then turn your head to the left. Back straight ahead. Anybody get dizzy with that? Okay. One last one. If we have enough room. Everybody just turn where you are. Just turn a circle. Okay. Just like that. Okay. Anybody get dizzy turning a circle?
A little bit.
A little bit. Okay.
Yeah.
Okay. Go ahead and sit down. Well, this is a pretty asymptomatic audience, which isn't a problem. Shuri,
Uh-huh.
can I demonstrate on you?
Sure.
Because you were the only one that had any vertigo while we're doing this. Okay. Well, come on up, Shuri.
Oh, yay.
All right. I'm glad I brought my table here. All right. Looks kind of wobbly, but I promise it is steady. And we can put your glasses there. I just sanitized, so that's what they have.
Okay.
Can you go ahead and sit up on there? Why don't you sit right there? I'll just hold it because it is kind of tall. Okay. For 21 years, the vertigo comes and goes. Right now, like when you walked in here today, are you having vertigo?
No.
Okay. So I don't hope to cause any vertigo, but I am going to test just so everyone can see what the vertigo test looks like. Okay. So this is for vertigo. So we're testing for an inner ear problem. There are different types of vertigo. But if she tests positive on this, which she may, even though she's not experiencing vertigo, then we pretty much guarantee she has an inner ear problem that can be treated with the maneuver that I was talking about. Okay?
Is that separate and apart from the crystals? that
No,
she-
this is part of the crystal
Okay.
problem, yes. And which, in the past, which side have they treated? Which one have they assumed that?
They did those.
Okay. Well, we're going to assume there's just one.
Okay.
Okay, so I want you to go ahead and just stay sitting, but turn your body so your legs are up here and you're sitting.
That's hard for a
Yes.
girl.
Okay, and then come over this way a little bit. So scoot your hips forward. Okay, so I'm going to stay right here, so don't worry, you're not going to fall off. And I'm going to hold your head, and I want you to look up and to the right. So we're going to check the right ear first. Go ahead and put your hands on your right lap. And we're going to lay back quickly on the count of 3. I will help you. 1, 2, 3. Okay, Sheree, so in this position, you have any dizziness. Okay, so it's a negative test. We would expect you to get dizzy right away. Oftentimes, we'll see the eyes start to shake side to side. That's called nystagmus. And if you see nystagmus, it's a for sure fix. Like we'll be able to fix them, no problem. We can still fix them without the nystagmus, but the nystagmus is nice. And then the dizziness will last about 30 seconds, and then it will resolve. That's a positive test. Can you hold on to my arms? Now on the way back up. Okay, good. All right.
No, I'm good right
Good right
now.
now. All right.
You don't want to see.
Yeah, no. Okay, so now let's just peek at the left ear. So we'll scoot over this way to the left side. So negative test there. So today will just purely be a asymptomatic demonstration of nothing. So let's go and look up and to the left. We're going to lay back on the count of 3. 1, 2, 3. And on this side, sure, and dizziness. Still doing okay? All right, we're going to go ahead and sit you back up. Cool. Okay, on the way up. Okay, so if someone gets dizzy on the way up from laying down, it's not a positive test, and I'll usually treat it for something else I'll talk to you about here. Now, but I'm going to demonstrate the treatment, okay? Okay, hold on to the table for just a second. Can I use that chair?
Oh,
Thank you. Okay, so we're going to lay it back just like before. 1, 2, 3. So she lays back like this, and usually experiences a wave of vertigo while I hold her here. And we wait 30 to 60 seconds. And what's happening here is we're moving the crystals and the fluid through the inner ear, putting it into a part of the ear that doesn't make her dizzy anymore. You'll all understand this here in a minute. And let's go ahead and turn your head to the side. So pretending that's been 30 to 60 seconds. We're treating the left side. So now the canals are shifting, and I'll explain why the canals, to a different direction. So gravity's pulling them down. And again, we're kind of, the crystals are, they call it the labyrinthine crystals, or sorry, the canals, the labyrinthine. And so it's kind of like going through a maze where we're trying to get the crystals float in a specific direction where they belong, to the inner ear. Okay, now go ahead and roll onto your right side and look down at the floor once you're there. Good. I won't charge for the hairdo today. Are you doing okay still?
Mm-hmm.
Okay. So back in the day, like in the 1960s, these two smart scientists discovered the direction that the canals carry fluid, and they used that to reposition the crystals, to place in the inner ear that no longer causes vertigo.
I have a question. Are you doing the affected ear?
Yes, left side.
Okay.
Okay, let's bring your feet up over the edge, Sheree, and then we're going to go ahead, yep, right in front of you. Yeah, and go ahead and sit up. Good, and we're going to keep your head down to the right. And we'll pretend that's 30 to 60 seconds, and then look straight ahead. Good, are you still doing okay?
Mm-hmm.
Okay, so typically after I do that treatment, I'll have the patient not move their head side to side like this for 72 hours. Yeah, that's tough. That's the tough, but people typically remember, or else I'll give them a soft collar, and then they'll just remember, turn with my waist, not with my neck. And then we avoid bending over with your head down. And then we sleep at a 30-degree incline. Now, my patients that follow those three rules after treatment, they tend to have much better long-term success. And then I'll do that treatment a total of 3 times. And that cures about 80% of my patients that have this type of vertigo. The other 20% that aren't cured, we go on to something called habituation exercises. But I just wanted to see you to see a typical repositioning treatment. So you're aware of that. And you're still doing okay.
Mm-hmm.
I'm going to get your glasses. I'll give you the $20, I promise, later.
Okay.
Thank you for demonstrating. Let's give a round of applause.
Yeah. Would you treat Meniere's disease that way?
So I've had a number of patients come in with Meniere's disease, and they get better with what I do. So was that really Meniere's disease, or was it misdiagnosed? Meniere's disease is kind of an interesting, kind of vague diagnosis. Basically, you have vertigo. It's episodic in nature. You're not getting better. There's no known cure. Let's just give them a diagnosis of Meniere's disease. I don't like the diagnosis because it's hopeless. And so I'll bring them in and say, let's just try and see what happens. And if they respond, we go with it. And usually we can find a cure. So like I said, there's very few that don't improve. Like we're talking like 100% cure rate with the treatments that we do. Great question. Any other questions?
You have to have a doctor's referral.
For us, you do, yeah. If you're going to do it through insurance, yeah, and we take every insurance, but you do need a doctor's referral. Just the state of Texas and most insurances still require that. Okay, so now we're going to go through our worksheet. All right, and for this first part, I need to draw out the inner ear on the board. I'm already messing up here. So, like I said, it's been a little while since I. Gotta use my cheat sheet here just to get it going all the way.
So does altitude have anything to do with?
I've had patients complain of that they say, oh, I did a lot of this or that, and it made myself dizzy, but I have never seen it consistently. More than anything, what I'll see is someone has an ear infection, sinus infection, or a flu, and then they have like a lot of fluid in their head, and then they have vertigo afterwards. That's probably the number one most common. Or someone falls.
Knocks the crystals loose.
I think that's what it is, yes. I'm gonna get it. Okay. Didn't mess it up too bad, so we're in good shape. All right, let me just explain the parts really quick, and then we'll go through what's what, okay? That's bad. Okay, so out here is we call this the outer ear. That's the part you can see. And then here, going from this section here is called the inner ear. And this is the middle ear. Okay, here's the head. Like here's your head, here's your ear, here's the bottom of the head. And only this part here and this part here, this is the eardrum, is involved in hearing. The rest of all this, well, I shouldn't say only this part, because this is the cochlea. And here is the semicircular canals, all right? We've got 3 of them. We've got a posterior, a horizontal, and an anterior. Those are the 3. So there's 3 canals. And then you have these little areas here. This is called a saccule and a utricle. All right, and they're 2 little what they call organs in the inside of the ear that help with balance, okay? So this part is for balance and movement. This is your cochlea, like a cochlear implant. And this part here is, of course, receives the sound and the eardrum travels through. Now, when you think about your inner ear, people always think ear, but it's better to think brain because it's right underneath this big bone right here. That's called your mastoid. And up underneath that sits your vestibular system. By the way, this is your vestibular system. And that's right underneath the brain. So it's inside bone. So all of this right here, that's all bone. Maybe this could better demonstrate, okay? So outer ear, your eardrum, and right here is your vestibular system without this part, because that's the cochlea. All right, so this is your vestibular system. You have your 3 canals, and then your saccule and utricle right there. And it sits, and then your brain's right here. All right, so it's better to think about it like your brain. All right, and then right here, this little section leading this way, this is called your vestibular cochlear nerve. And it carries hearing and movement sensations to your brain. All right, and we'll get more in depth right there in just a second. Okay, so number 1, what is vertigo? A sensation of spinning or movement when the body is not moving. So vertigo is a sensation of movement or spinning when the body or the room is not moving.
Sure the room isn't moving?
Exactly, Bill. So I like to think about it like, so the inner ear senses movement. You have 3 ways to sense movement in your body. All right. Try to think of a way that you can sense movement. Like right now, how do you know that I'm moving? With what? Your eyes. So your visual system can sense movement. All right. Now, if you close your eyes and you start swaying back and forth, how can you tell that you're moving? Your vestibular system can sense that, can pick it up, and also your body touching your chair. That's called somatosensory. Your somatic system can sense, oh, I'm moving because I can feel my back leaving the chair. Okay, so we have those 3 systems: vision, somatosensory, and vestibular. If one of them is off, then it throws off the whole system. And that's what happens with the vestibular system. Okay, so I'm going to take a subset of this. I'm gonna pretend I'm cutting out the bone right here, and I'm going to magnify that, okay? So I'm just taking this little section of this canals, these are 3 canals, and I'm going to magnify them. Hold on, I want to show you this.
We'll be doing it from the hallway.
Okay. Okay, so I just took that little section, okay? So here's our canal with the bone. We're going to blow it up. So inside the canal, we have fluid. We call this lymph, perilymph. It's like oil. That's how thick it is. Okay, now floating in the oil, well, not floating, but sticking out through the lymph are nerves, nerve hairs. These are tiny little hairs that have nerve endings on them. And then they connect like this to the larger nerve, the vestibular cochlear nerve that carries the signal to the brain. Okay, so we have this fluid, and when your head moves down, the fluid's going to move that direction, and it carries the hair with it, or it may move backwards, or you accelerate. It's kind of like you're holding a cup with water in it, and there's ice floating on the top, cup with water and ice, and you start walking, the ice is going to go backwards. And that's what happens to these hairs. When the hairs move, it can sense movement, sends that signal to the brain. Now, we have these little tiny crystals. Okay, here's a few of the crystals called Autocadmium. All right, and they're like calcium carbonate, so really harmless. The thing is, though, the crystals typically reside in this part of the inner ear called the saccule and the utricle. That's where they hang out. But sometimes, for some reason, if there's too much fluid, or if somebody falls, or even if someone has high blood pressure chronically, these crystals can get dislodged and start floating around in this part of the inner ear, the semicircular canals. So we're looking at otoconia that aren't supposed to be there, these little crystals. And what happens is these crystals, they adhere, stick to these hairs. So they latch onto them. And so if you move and the hair bends down like is normal, when you stop moving, the hair is still bent over. So the nerve is picking up a signal, and it feels like you're moving when you're not. So like, like you described, Bill, like if you sit up the wrong way, and all of a sudden you feel this movement. Yeah, no, you're fine. Then that crystal may be sitting there and causing some issues, making you feel like you're moving when you're not. Or Cherie, like when you have these episodes of vertigo, those crystals are hanging out there when they shouldn't be. So the purpose of the treatment is to use that fluid and gravity to get those crystals moved into the part of the inner ear that no longer causes vertigo, the place where those crystals belong, which is the utricle and the saccule. All right, if you have questions, don't hesitate to interrupt me. Yes.
We've got a few people online, and they can quite see the
Board?
the board. The board, they're fine. It's just the model was just
Yes,
a little
this
too
model?
high. It was just slightly out of camera view.
What should I do? Put it right here?
Well, so just next time you use it, just
Hold it.
lower just a
Like
tiny
this?
bit. That's perfect.
Okay. All right, so this was, that's
But now
fine.
can everybody else see it?
Just, yeah, I think it's just a picture of the vestibular system, vestibular cochlear system. So this is the nerve that carries the signals to the brain. That's the cochlea. And then here are the 3 canals. All right, now typically, for some reason or another, the otoconia, the crystals pick this posterior canal, and that's the canal we treat the most. I hardly ever treat these other 2 because it's just not necessary. So that sits right under the brain. Okay, so we're on to 1B. So vertigo, or it, may be caused by a condition in the inner ear or vestibular nerve. So some of you that continue to have vertigo even after treatment, you may have a vestibular nerve hypersensitivity, which we're going to talk about. Okay, so 1B was ear or nerve. Now 1C, it is usually aggravated by turning the head. So that blank there is turning the head, rolling over, looking up, or bending down, or walking down a hallway. And I put in 1D, it may be caused by crystals in the inner ear. Okay, on to number 2. Now we go through these pretty quick. There's only 6 of them, so don't worry, we're not going to go overtime or anything. So just a little bit about myself. How did I come to specialize in vertigo and dizziness? Well, when I was in Houston, I did an internship up in Conroe and studied under a vertigo specialist. The first patient I saw with vertigo was a lady who was walking with a walker because she was so dizzy, she could hardly even walk. And I watched her over a period of about 2 weeks become completely vertigo free. And that like sparked my interest. And then I just started applying those things that I learned, attending different classes and seeing some great success. So the one person I wanted to tell you about was a younger girl. Her name was Brittany. And she was a trampolinist, like elite, like world championship type trampolinist out of Levelland. There's a lady there that has a trampoline like clinic that she's a coach, and she takes people to the Olympics in trampoline. So this girl, all through high school, she was this trampolinist. So she got done with high school, she was done with the trampolining, and she was actually wanted to go into speech pathology. And she was sitting in some testing center taking a test here at Texas Tech, and all of a sudden this wave of vertigo came over her. And I believe she was diagnosed with Meniere's disease somewhere in Dallas. But I had treated her for her trampolining problems in high school, and she came back to see me. And when she saw me, she could hardly even move. If she went into, like, walked out through a grocery store, the things in the aisles, the items in the aisles going by her made her dizzy. Or if she went into a room with bright lights, she'd get dizzy. She could hardly do anything. And anyway, we started the treatments on her. And within a short period of time, she was completely better. She actually changed her profession, decided to go into nursing, and today she's I think she might actually be a nurse practitioner. No issues with vertigo at all. So that application with her really helped to spark additional interest, and that was years ago in additional treatments for her. So 2B and 2B I'm going to skip. Is this book about dizziness and vertigo, but 2C are the top 6 exercises for balance report. So if you fill out your worksheet here, then at the end I'll give you a copy of the 6 free exercises for balance at the very end. Was it say 5?
Yeah.
I thought, oh, it's 6. Mine says 6. So maybe you get a bonus.
No, I missed one.
Maybe. We'll all count them before I get into it. Yours is like, I've made some updates to this, so I may have a newer copy.
Okay.
We want to make sure we get that 6
Exercise.
Right.
Yes. Okay, so number 3, the first step to figuring out vertigo or dizziness is to ask this question: is the vertigo or dizziness reproducible? Reproducible. So what we mean by that is, does it come and does it go? And when it comes, is there some movement or position that causes it? Because someone who is constantly dizzy all the time and it never changes, they're going to be really hard to treat. Because there is a possibility that something more serious may be causing the vertigo, like a tumor. Very rare, but maybe a tumor. Or they have a major heart problem where they're just not getting enough blood to their brain, or things of that nature. So that's the first question to ask is it reproducible? So I had a patient, her name was Judy, and she would get dizzy every single time she laid down. And she had it for years, and she was taking Meclizine, which is like a Dramamine, like a motion sickness pill. Have anybody here had to take Meclizine? Yes. So Meclizine is a vestibular nerve suppressor. So it takes the vestibular nerve that carries signals to the brain, and it diminishes its effect. So the problem with that over time is it actually produces more sensitivity in the vestibular nerve. So if you're taking it for long periods of time, I would recommend getting treatment to fix the problem instead of just covering up the problem. Because long-term Meclizine use can cause additional issues. So, but this lady, Judy, she could never lay down in bed. And she was a younger lady because she was so dizzy anytime she laid down. And of course, you know how this story is going to go. She got completely better and didn't need the pills anymore. And was very, very happy to get back to normal life. So, but the good thing about Judy is she got dizzy when she laid down. It was reproducible. And when she would stay sitting up, her dizziness would drop. And that's in 3A there. It says, if so, then it is likely reducible. So if you have dizziness that can be treated with physical therapy or movement, then it is reproducible with movement, and it is reducible with a different movement or position. And that's really important to understand. Okay, so number 4, we're going to kind of skip that because we talked about what kind of things tend to make you dizzy, and many of you shared what made you dizzy. So let's look at the most common mistakes that dizziness and vertigo sufferers make. So number 5, the most common mistakes that dizziness and vertigo sufferers make. Okay, that's the most common mistake right there. They ignore it or they accommodate it. So they basically say, well, I only get dizzy when I do this movement or activity, so I just don't do that movement or activity. And then all of a sudden their life becomes very limited because they took that activity out of their life. So we try not to accommodate it. All right. Number 5A is the 2 words there: live with it, or B, that's another option you have, fix it. So they can accommodate it. That's the biggest mistake. They try to live with it, 5A, and 5B is you can fix it. All right. That's obviously what we're trying to go for here. Okay. I like to think of this like concentric boxes. Okay. So let's say out here are activities like walking, housework, like cleaning your house. And when you have dizziness that tends to be chronic and untreated, maybe you have to eliminate or minimize those activities.
Oh, yes, let's get rid of the house.
Right.
I shouldn't have chosen that one. I should have chosen gardening, something fun, right? There's some people like gardening. And then maybe here is sitting or driving. And as that starts to make you dizzy and you accommodate it or live with it, you don't get it treated, and you box yourself into all you can do is just lay down. And I have patients where all they can do is just sit or lay down because they box themselves in, not getting treatment, just trying to live with the vertigo, not realizing that there's a cure out there. And so my suggestion there is find out how to fix it once and for all without drastic measures. This patient of mine named Brittany, the one I told you about that was the trampolinist, what they do for those kind of patients, like the surgical treatment, is they'll put a drain into their inner ear and they'll drain out excessive fluid. So it's like a shunt. And it's terrible. I had somebody come in with it, and it's a terrible procedure. Much better to find out how to fix it conservatively than to try to do it like that. Okay, any questions? We're going to go on to number 6. These are the most common causes of vertigo. Okay, who knows number 1? 6A, crystals in the inner ear.
That's the word, but nobody memorized it.
Yeah. What? Otoconia. Good job. So those are the crystals, but don't put that in the blank. That's not the blank.
Okay.
Yeah, I'm going to tell you exactly what this is called. So this is the first most common cause is positional vertigo. So it's position dependent. So when I stand up, when I lay down, that's what causes my vertigo. Okay, and this is dizziness with changing positions, and it may result in eye movements called, what are those weird eye movements?
Nystagmus.
Hey, good job. This is how we spell it. If you ever want to do this just for fun, just to see what nystagmus looks like, and you have grandkids and they like spinning in circles, just tell them, stand right in front of me and spin for me 20 times, and they'll love it. And then when they're done with their 20 spins, hold on to their head and stare at their eyes. And if they spin themselves well enough, their eyes will be doing this, and they'll be laughing the whole time. And so you can see what nystagmus looks like, but that's what patients experience. I had a patient named Bridget, and I laid her down just like I did Sheree, and her eyes went to spinning just like this. We did the first treatment, she was 50% better. Second treatment, 80% better. By third treatment, 100%. No problem, fixed completely. And most of the time, that's all it requires. Okay, so 2B. There's a second type of vertigo that is called orthostatic hypotension. So orthostatic hypotension. Okay, what's the opposite of hypotension?
Hyper.
Hyper. Anybody here have hypertension? That's high blood pressure, right?
Yeah.
I'm sure some of you did, yes. So hypotension is a temporary state of low blood pressure. My patients that have this, they get dizzy when they go from laying to sitting up or from sitting to standing up. And what happens is the veins in the legs don't contract fast enough when you change position from laying down to sitting up. And so the blood quickly drops and pools in your lower extremities, and the blood pressure in your brain drops, and so you feel dizzy. It's usually temporary. People have to hold on, although some people can fall down, but they have to hold on, or they have to just practice getting up slowly. Accommodate it. I'm going to get up slowly. I have to sit on the edge of the bed before I stand up because I feel dizzy. So that's orthostatic hypotension. And it's very treatable with the right exercise. So we put there under 6B, vertigo with laying to sitting or sitting to standing. Okay, and
That's in the blank.
oh, hypotension. Hypotension. There's the
It's already printed there.
Oh, you guys have the updated copy. Sorry, if I'm missing any blanks, please tell me and I'll help you update. That's right, friend. Let's see. Orthostatic hypertension. Yep, that's right. All right. Oh, I should have updated that a little bit. Okay, so I had a patient named Don, and he says this on his last day. He wrote this: before therapy, I walked with a cane, stumbling frequently, and had fallen several times. I got dizzy when I bent over and had numerous episodes of vertigo. So he would bend down and have that blood change and then come back up and woo, just start spinning. Okay, so he had orthostatic hypotension. So 2 months later, I no longer use a cane, have not stumbled anymore, and no longer fall. The vertigo is gone, and I can bend over to pick things up without getting dizzy. I feel better than I have in the last 5 years. I treated his wife later on for a knee replacement. He was still doing well, which was really exciting for us. Still no issues. Okay, the third most common one is stress or feeling anxious. And we call this stress or feeling anxious. Hopefully that's what your blank says. We call this anxiety induced vertigo. Okay? Extremely common, but rarely diagnosed. So this is, you remember the girl I told you about, Brittany, when she was sitting in the testing center and she got dizziness and she was later diagnosed with Meniere's disease? This was what her situation was: extreme stress of dealing with school, and she experienced this vertigo, and that just added to her stress. And so by identifying the stress and connecting the stress to the vertigo, the stress resolves. I had a patient who started to develop vertigo after her granddaughter brought a German Shepherd to visit her in her house because her son was killed because of a German Shepherd in high school. And once she identified that, her vertigo went away. And so this is a really significant part that oftentimes when my patients come in, I'll say, when your vertigo started, was there anything stressful going on in your life? And usually by them identifying that stress, the treatment goes so much better. I had a patient from Brownfield who was caring for his wife with Alzheimer's. Very stressful to be a caregiver for someone, especially for our adults. I have so many patients that their stress levels are super high when they're caregiving for other adults. And when he could identify that, his vertigo went away in a period of weeks. It was a quick resolution, and he'd had it for some time. So stress or feeling anxious, anxiety-induced or stress-induced vertigo. Okay, so number 7. Are any questions up to this point? All right, how do we treat these things the vertigo successfully? Accommodate all the time.
So can it be like time delayed?
So explain what you mean.
Like I fell at work and like 2 or 3 weeks later,
Experience some vertigo. When you fell, did you hit your head?
no, I didn't hit my head.
Maybe. Had you ever had vertigo before that? Yeah, possibly. But probably the better thing to identify would be, do you test positive for positional vertigo, like the test I did on Cherie? And if you test positive for that and we can move the crystals around and you get better, well, Who knows why it came on, as long as you get better. Yeah, it
And
could.
it would be nice if the ENTs would tell you to go to a physical therapist. because
Some do,
Some
some
don't.
don't. Most of our referrals for vertigo come from primary care doctors, yeah, not specialists. So, okay, so how do we treat these successfully? Well, the first one is the maneuver you just saw me do on Cherie, which is Epley's maneuver. And that's just repositioning those crystals within the inner ear. So you should be able to tell your sister in Las Vegas all about this. We're taking the crystals from the canals and putting them in this part of the ear, and it no longer makes them dizzy. Now, people will often ask me, well, does it stay there? How do we make sure they stay there? And usually they do. Rarely do people have to come back later on. But those patients that don't get completely better with the Epley's maneuver, I give them the next one, and that's what we're going to cover here. 7A, vestibular habituation exercises. Habituation exercises. All right. So every nerve, including this vestibular nerve that carries signals to the brain from the inner ear and from the cochlea, so hearing and balance, every nerve has a characteristic called habituating. So it's almost like thinking habit forming. Yes, is that lower?
Sorry.
So for example, when y'all came into this room today, you probably could smell the smell of a room. Every room has a smell. But as you sit here, you can no longer smell it because the olfactory nerve, which picks up smell, it accommodated the smell because it wasn't smoke or it wasn't a bad smell. And so your brain says it's not dangerous. So it just turns it off. So you don't even have to think about it. Okay, so the brain can do the same thing with the vestibular nerve. Sometimes my patients that have had vertigo for a long time, it's almost like the vertigo becomes the new norm, the new habit. And certain movements they become very sensitive to. And I call that vestibular nerve hypersensitivity, where the vestibular nerve will produce dizziness just based on the movement, even when it's not necessary. So we try to habituate or desensitize the vestibular nerve through movement, through repeated movement. So this is very common. Well, vertigo is not common, but this movement is common in astronauts, where you see astronauts as they prepare to go to outer space, they get into these devices that spin them every direction. Have you ever seen this, like at NASA? And what they're doing is they're training themselves to not develop vertigo in case their spaceship flies out of control upon re-entry, so that they don't lose their sense of balance. So we use those same principles in physical therapy. So for example, Bill says, well, every time I get out of bed with my head in the wrong position, I get dizzy. So guess what the treatment's going to become? We're going to get out of bed like that 10 times, 2 sets, twice a day, until that movement no longer makes Bill dizzy. It's amazing how this works. So I'll have patients do things like, I'll have them take a pen and they'll watch the pen up and down like this. Now you and I doing this would probably get a little bit dizzy trying that right now. That's normal, but my dizziness goes away in a matter of 2 seconds. Or I'll have them take like a ball or some device and they'll trace the ball up and around like this. And the first couple of times they'll have to sit down because they're dizzy. And then after that, they don't get dizzy anymore. Or we'll have them sit on the table and they touch their ear to each side, like on the treatment table. And then it doesn't make them dizzy anymore. And then it usually translates into life, to where normal movements just don't make them dizzy anymore. So that's habituation exercises. Now, if I have a patient who I do the Epley's maneuver and they get better with that, so they have positional vertigo and the Epley's maneuver makes them better, like Cherie, she'll get better with the audiologist, you said, right? She'll do the treatment. But then it tends to come back. So with a patient, like if you were my patient, I would say, okay, Cherie, I'm going to give you this list of habituation exercises to do. And after we get done with your treatment, I want you to do these every day for a month. And then if you ever feel vertigo coming back on, go right back to these exercises. And most of the time, vertigo's gone for good. And I've not been taught this, but my personal observation is that vestibular nerve can become a little bit hypersensitive to normal movements. And so we have to desensitize it through habituation exercises. And that usually fixes the rest that don't get fixed with positional vertigo. Now, I also use habituation exercises for orthostatic hypotension, where someone stands up and they develop low blood pressure temporarily. We do habituation exercises for them, and it tends to be very successful as well. Okay. Now, is there a blank on 7B where it says blank exercises?
Yeah.
Yes.
Okay. That's a vestibular, which is very similar to the habituation. I apologize, I need to update my sheet. So you can write in there though, vestibular exercises. Okay, and 7C is occasionally mind, body exercises. Okay, so these are for my patients where there's a major stressor, or sometimes minor, that is potentially causing their vertigo. And like I said, this tends to be very successful. But the key with this is not stress elimination, but stress expression. So I have patients where they go through something very stressful in their life and they just have to hold it all in. And so I'll really encourage them to either write about it or to talk about it, to process that stress and to get it up and out. And that tends to improve the vertigo. I know it sounds kind of crazy, but it works. And it
Screaming at a fellow.
yeah, maybe screaming at a fellow, yeah. And all of a sudden the vertigo goes away. With this also, I do something very interesting with my patients. People who've experienced extreme vertigo, it tends to be very like fear, like it can really induce a lot of fear in you because it's a really traumatic experience. I don't know if
Yeah, that's me.
yeah. So what I'll do with some of those patients is I'll say, okay, when you experience vertigo, challenge it and invite it to get worse. You know, when you feel dizzy, say, is that all you got? I can handle so much more. And there's something psychological about that where the vertigo says, okay, I'm not going to get you. So then it kind of just drops off. And it can be really effective. Now, those of you who have vertigo or history of vertigo, I'm not suggesting that you jump right to this. There may be some other steps ahead of time. But if you can't get your vertigo to go away, well, maybe you're missing the mind-body connection. Please.
I've had it for 25 to 30 years. Does it get worse with age, or is it just coincidental that I'm getting older and it's worse?
Majority of my vertigo patients are over the age of 50. But those that have had it for many years, they don't tend to get worse with age. But most patients that develop vertigo tend to be older. So one of my other therapists showed me this article where they found that people over the age of 50 with high blood pressure tend to have more otoconia, or the crystals in the inner ear. We don't know why, but they found a link and they said potentially there's something with high blood pressure and age that produces more crystals. So, or dislodges them maybe, because it's not really producing, but dislodges them. So good question. Okay. So I just wrote on the bottom page of the page there, super important point. There are different treatment programs for the causes of dizziness and vertigo. As you can see, doing the right one to address the cause of your dizziness results in permanent relief, feeling better, and living life. Doing the wrong one can make symptoms worse. I shouldn't say frequently, but can make the symptoms worse. So if you ever want to get treatment for vertigo, one of the things is if you were calling around to physical therapy places or audiology places, you would say, is there anyone there that treats vertigo? And then you ask, when you treat the vertigo, does it typically go away and stay away? Or does it tend to come back? And the treatments tend to work for a little while and then it tends to come back. And if they tell you that it's permanent and tends to be permanent relief, that's a good place to go. If they tell you it tends to come back, keep on calling around until you find someone that can cure it once and for all. I've had patients that have had vertigo, like I said, for years that have gotten better with the right treatment. So, any other questions?
I have a question.
Please.
So what is the function of the autocadmium when it's in its proper place?
That is a great question. No, I don't actually know the answer to that. I know that they typically reside in the saccule and utricle, and it's calcium carbonate, but I don't know why they form there. Now you tend to dislodge more as you get older, so maybe you're building up. You know, just like you can build hard water up on a sink or a faucet. Maybe they just build up. I don't know if they have a necessary purpose. There's lots of fluid moving through the inner ear there because it has to move those little nerve hairs, right? Like I showed you. And so, you know, fluids can sometimes lead to buildup. Good question. Any other questions? Good ones or bad ones? All right. Well, you made it through the workshop. Now, because you laughed at my corny jokes and you, okay, nobody fell asleep. If one thing that we do at our clinic, and this is totally if you are interested, is we offer free screens, free consultations, where you can come in and sit down with myself or another doctor of physical therapy that specializes in vertigo and dizziness. And we can assess your dizziness and see if there's something that we can do to help you. And if there is, what we do is we fill out a prescription and send it off to your doctor. And 90% of the time, the doctor signs it, sends it back, we do the treatment. Within 2 to 4 weeks, you usually are completely better, and then you don't have to deal with the vertigo anymore. Yeah. We take practically every insurance that there is. Yeah. So I have these little slips here that just if you want us to call you, just write your name and your phone number down. Best time to call, and we will call you sometime in the next week, and we'll schedule a free screen with you. So I'll leave these up here if anybody wants to fill it out, feel free. But you know, and if you're like, okay, I just want to get treated, you can see your doctor and get a prescription and just come in and we can treat you for vertigo.
I've been through treatments at other physical therapies here in town. Doesn't seem to be permanent. Is that because I stopped doing the exercises when I feel better? Or
Maybe.
it just keeps coming back periodically?
Typically, once my patients start the treatment, it doesn't tend to come back periodically.
Okay, what's your phone number?
So yeah, but no, I mean, it would be worth it just to take a look
Sure.
and see. And you can also share with me or one of my other therapists, the treatments that you've received.
Okay.
And we can see if there's anything that we can add to help that. Okay, any other questions?
So I had
Yes.
a question online. Somebody wanted to know, what are balance exercises?
Yes. Thank you for asking. All right, we're going to count these to see if I'm wrong or right. So 1, 2, 3, 4, 5, 6, 7, 8.
Everybody
I gave you
goes.
some extras, yeah. So, all right. I'm forgetting your name.
Chuck.
Chuck. So Chuck says that when he stands up and turns, he'll get dizzy. Not necessarily when he's drinking, but
dizzy.
other times.
Out of balance.
Out of balance. All right. So we assume with Chuck is that he's got some proprioceptive deficits in his legs. So proprioception is the
No, it's
ability.
when I'm standing that it doesn't.
Yes.
And I suddenly
And
change
you turn.
direction.
Yes.
That's when I lose my
I may have
balance.
said it wrong. So you have nerve receptors in your legs that aren't communicating fast enough with your brain, because the brain very quickly has to send signals back down to change the muscle force so that you don't fall or anything like that. And so proprioceptors, which are specialized nerve receptors, can improve with exercise. So the purpose of doing the balance exercises is to improve your ability to sense position and movement and to make muscle changes in order to keep yourself from falling. So the balance exercises, and I can send you these if you want to send them to people online, if you can remember who's attending, are strengthening exercises and exercises like single leg balance or single leg stance or a tandem walk that can help to improve strength and proprioception in the lower extremities. So I'll put these up here too. For anybody who wants one. I mean, I don't know if you have the ability to scan, but you could also scan it. Okay. So if anybody, as you're on your way out, as long as you fill out your worksheet, you get one.
We have to sign.
No, I'm just kidding. You keep the worksheet. All right. Good questions. Any other questions? All right. Thank you all. That's all I have. So appreciate it so much. Great.
I've got, I guess,
Yeah.
more of a personal question.
Sure.
When my vertigo hit me, I was in bed middle of the night, and I fell out of bed with like an 18-year-old who had way too much to drink,
Okay.
and throwing up and all that, and I couldn't go into work for a couple of 2 or 3 days. But I went in, I went to an ENT, like primary care, sent me to an
ENT.
ENT.
Yeah.
It was associated with audiologist and physical therapist. And I was interested, like 45 or 50% of the nerves in this ear
Were not functioning. So
they
you
said-
had.
they said they were dead.
They're-
Oh, yeah, they weren't functioning.
Okay.
And after that, tinnitus, and a little bit deaf. Too. You know, I think it's more, you know, for me, it's more than just the crystals. All the crystals were there. We did the tip.
Tested positive for
Yeah.
positional vertigo.
Yeah,
Your eyes were shaking.
and they still do that at the right time of the day.
But you don't know what caused it?
They speculated with some kind of a virus that
Attack the vestibular cochlear nerve.
It was terrible. It was absolutely terrifying. I can assure you.
I spent a couple days sleeping on the recliner.
Yeah. Yeah, you know, that's interesting. It was surprising how many of my patients develop symptoms in the middle of the night when they're doing nothing. You just wouldn't expect it. But I would find you very interesting to if you came in for just that free screen, just to find out a little bit more about what you've done to treat it, what it's like now.
Hard to remember. You know.
I mean, the fact that you've improved some now, that's a good sign. You know,
But it's not limiting. It's just
a little bit of movement.
Have you ever had anybody throw up? And,
Yes.
Yeah,
It's rare. Usually they're not. throwing
that's
up.
what happens when
But you know, after the first treatment or two, they don't throw up anymore. Yeah,
Does motion sickness have anything to do with this?
they can. Yeah, because that can. And the treatment can be very similar.
So it.
Does that make you get over the motion sickness?
Yes, it can.
Oh, really?
Because
I'm
going to
sorry.
the IMAX?
Not your way.
All around and up and down. Yeah.
Yeah, and then.
Yeah, I can't even go to the IMAX.
So there's some motion sensitivity there,
I would take motion.
and
sickness.
there's certain movements you can do to train yourself out of it.
But I didn't used to.
Because
be
that's
like
when I take
that.
motion sickness.
That's when you're driving. Are you dizzy any other times, or just when you're doing those things?
Yeah.
Well, that makes me sick.
Right, but do you get vertigo or dizziness when you're not doing what you just explained? Okay. Yeah, it'd be interesting to look at you a little deeper. And see.
I have another interesting question.
Sure.
What makes people afraid of heights?
That doesn't have anything to do with this.
Nothing at all.
Falling.
We're talking about going up in an elevator to the top of a building and looking over the edge, and they become petrified.
Yeah. It's kind of a learned behavior.
On Sunday, visiting the relatives, he beats the 3 o'clock train every morning on Sunday, so he scared his poor kids to death.
It's a learned behavior,
Is that what it is?
and you can
I
unlearn
didn't
it.
know
But
that.
sometimes if there's a lot of fear involved, it requires a little bit of psychological help. Yeah.
Okay.
I don't have that, but I know some that have it.
Yeah, I have
They
patients.
can't
that-
fly airplanes for the same reason.
I know. Yeah, please.
I've had motion sickness ever since I was a kid, but I don't normally throw up. I sit in the front seat.
Yeah.
Well, on this last trip to Vegas, I would drive or ride for 2 days. When I stopped, I started throwing up. So I think I've invented a new disease.
Post motion. Yeah.
Yes,
sickness.
and I ended up going to the ER because I wasn't sure what was wrong. And they said, there's nothing wrong. They tested for COVID and blood work and everything. And they just said, here's some pills.
Take some
try
Dramamine.
this."
Yeah,
And
Meclizine.
I have to, if I drive for more than an hour. And like you were saying, IMAX.
Yeah.
I'd have to take a motion
Yeah, I
pill
can't
for
do
that.
But I didn't used to be like
Uh-huh.
that.
But you didn't used to be this old. either.
Well, that's true. This is the first time I've been this old.
Well, people tell you to act your age. Well, I don't know how to act this age.
Yeah.
I've never been here
Yeah.
before.
Experience. So I have read some articles on motion sickness. Now, people that come to me, they're not usually complaining of motion sickness. They're usually complaining of dizziness with everyday movements.
Right.
But I have read about and treated some of the motion sickness. So,
But I don't want to be on pills the rest of my life.
no, exactly.
So I don't know if treating vertigo would help the motion sickness.
Yes, that's what the research suggests.
That they are connected.
Yes. Movement dependent. Well, good questions.
I hope so, because I got tired.
Yeah. Tia, have you ever had vertigo?
I did, when I was, rode the roller coaster for my last time.
I didn't gave you,
It was bad, yeah.
Really?
Yeah.